Hi, welcome to Healthy Alternatives, where we explore complementary and alternative medicine, as well as other lifestyle choices that promote and enhance human health. Our guests tonight are Hillary Norsha and Lori DePietro from the Central Connecticut Health District, and they're here to discuss National Public Health Week.
Yes.
So welcome to our show.
Thank you for having us.
So, what is National Health Week?
Well, National Public Health Week is an annual health observance. It's usually the first week in April. This year it's April 2nd through April 8th, and it's just an opportunity for the nation to kind of understand, get a better understanding of what National Public Health Week is and what public health is in general.
I don't think people think public health. I think they have no idea what that is.
I'll take that question. Public health is it's the practice of general health of the community, and the practice and study of ways to preserve and improve that health using educating the community, and it also includes health education, sanitation, control of diseases, as well as the regulation of pollution.
Okay. So it's really safeguarding the environment.
Yes.
And educating people about certain kinds of exposures and But there's other things you guys do too. You have certain initiatives that you conduct over the course of the year.
Yes, we do. We have our flu clinics that we do every year to help prevent that, and we also have several grants that we work on that include asthma. We have a senior dental program, and we also get a block grant from the state, and we've been concentrating on nutrition and obesity. So
that's really this year's focus for you.
Yes.
Is dietary, nutrition, and obesity. Well, that's a big problem.
Yeah, obesity is definitely.
Yeah, and our First Lady is taking the lead, so it's.
Yes, she is. And actually, in our nutrition program, we are using the program Choose Your Plate.
Yep.
Now, what is that? Choose Your Plate. What's involved with that?
Well, it's a governmental website. It's choosemyplate.gov, and it's the food pyramid has been revamped. Instead of being a pyramid, it's now in the form of a plate. Oh, okay. So all of the food groups are broken down, I think, to make it more appealing as well as easily understandable.
Yeah, well, I think when people are used to having food on a plate and not a pyramid, first of all.
Yeah,
which is sort of,
absolutely. So it's more geared towards children now, as you know, Mrs. Obama is doing a lot with children and getting children active and things like that. So the dietary guidelines are based around the plate. So we're incorporating the dietary guidelines in our classes. So.
And then on the obesity end of things, we're doing gardening classes, which have been very popular, and we actually have a waiting list. And I'm trying to get in touch with the Yukon Extension Program because they have a Master Gardener program. Oh. And actually, they did call me back, and we're going to hopefully plan on another class.
Well, that'd be great. We could have you back and talk about that on a future show, if you wouldn't mind.
Yeah, and we're just trying to encourage people to start their own gardens in their backyards to grow their own vegetables. So, I mean, if they're there, they're more likely to eat them.
Right.
And, and have a healthier lifestyle.
Yeah.
So
getting back to Public Health Week, which is we're in the middle of it.
Yes, we are.
Right?
Public Health Week.
All right. So tell us what's an interesting fact about Public Health Week? How did it get started?
I think it really got started because people aren't really helping themselves, and we want them to be educated and learn how they can prevent diseases.
So it's geared around prevention.
Yes.
Right.
And according to the American Public Health Association, over 1 million Americans per year die from diseases that are preventable.
Now, let's think about that. 1 million Americans die from preventable diseases.
Such as heart disease, diabetes, stroke,
things that aren't necessarily,
cancer.
And these are all kind of, for the most part, self-induced diseases.
Right, absolutely.
Right.
Right.
And I think people take public health for granted, but it wasn't that many years ago that it was really probably a public health initiative to put the warnings on cigarettes.
Right.
People just didn't make that connection between smoking and cigarettes. So I guess a large part of what you do too is like linking sort of more cutting-edge science and information and trying to bring it to the public's public
Yeah,
eye.
we try to use evidence-based programming, which is programming that's been tested out nationally, such as Putting on Airs, our asthma program. Its research backs up that it works, and that's our home visitation program for asthma. So as much as we can, we try to use evidence-based programming because we know it works, and it's more likely actually to get funding. Funders like to see that.
Yeah, so, it is kind of comforting to know that there's an organization that's, I don't know, it's kind of like a health watchdog for the public, right? Is what
Absolutely.
we do.
We found in public health, many public health officials actually have found out that really a lot of people across the nation have no idea what public health is. There's really a big initiative called What is Public Health? And there's a website based on this, and it's just people that are putting stickers around town and asking people what is public health, and a lot of people confuse it with healthcare. A lot of people confuse it with treating health, but it's more the preventative aspect of it. It's more on the other side of the spectrum, preventing sickness, promoting health.
Right. So what are some of the things that you, especially this week, focusing on for prevention?
Well, this week, National Public Health Week this year, each year it has a different theme. This year it's A Healthier America Begins Today, Join the Movement. And normally they have one broad theme that they just discuss. This year there are 5 subtopics, 5 sub-themes. So there's one per day for Monday through Friday. Monday, April 2nd, yesterday, it was Active Living, Healthy Eating. Today, April 3rd, it was Living Tobacco and Drug-Free and Preventing Alcohol Abuse. Tomorrow, Wednesday, April 4th, will be Preventing Communicable Diseases. April 5th is Reproductive and Sexual Health, and April 6th is Mental Health and Well-Being.
Okay, so maybe we could briefly talk about some of the things that your findings and any information you want to pass on to the public about these particular, for instance, active living, healthy eating. What types of what types of guidance are you giving people?
We're really encouraging people to exercise their way. We want people to not do something that they don't like, because if you exercise and do something that you don't like, you're not going to stick with it.
Right.
And the guidelines do say
you should
that
really want to do it.
yeah.
Right.
Absolutely.
And the guidelines do say that you should exercise 5 times a week, 30 minutes a day. And really, I don't think that's happening for most of the public right now.
People are just so busy.
Sedentary,
Yeah.
and they're just, they can't fit it into their day.
Right.
Or they try to, and it's not something they like. Oh, I got to go to the gym again, so they don't do it.
Right.
So we're really trying to promote something, people to pick something that they can stick with, like, and also some alternative things that people haven't done in the past, like that's more popular, like Tai Chi or yoga.
So really,
Pilates.
and exposing people to different things. Maybe they had no idea that would be a form of exercise.
Right.
And we also want to encourage people to go to the website choosemyplate.gov and really, picture your dinner eating off a plate and doing the correct portions, because I think it's a great visual. And
Well, I think
really
the portion
understand
control
it.
is a big
pitfall
for a lot of people, especially we're so used to going to the restaurants and it's all you can eat, and
The plates are very large.
they're large.
Yeah.
And people, that's the expectation. So then when you go home, that's how seconds, which that's. So we do. Americans like their food, and so I think it is going to take a sort of a public awareness about the role of food and eating.
Right.
Right.
And we also want to promote.
Because a lot of those diseases you were talking about earlier are obesity-related
Yes.
illnesses,
Yep.
right?
Yep. Very much so.
So then today is living tobacco and free and preventing alcohol abuse. Even in this day and age, it's amazing to me how people are still smoking, and young people in particular. Is that your findings, that it's going down in maybe the middle-aged population and increasing with young people?
Yeah, we've seen a decrease in our district, actually, of smoking.
That's good.
But there are still 11% of people in our district that smoke. So, and we did an assessment back in February and found this out, a 400 random digit dial survey, and that was one of our findings. So it still is
So
a
you
bit of
call
a
people
problem.
up and ask them if they smoked?
In the past, yes.
Yeah. Oh, in the past so many months?
Right.
Or, you know, how many, if you've had a cigarette today. I can't remember the exact question, but, you know, we actually base this survey on from the behavioral risk assessment, which the state does every year. So they already give you the questions, and you get to pick which ones you want to incorporate and in your survey.
And then obviously you discuss cessation methods.
Yes.
Yes, and we're also trying to promote the quit line. There is a quit line if available for anyone in the state, and they can call that quit line.
For smoking.
Yes, and they can call 211, and they can give them the number of that quit line. And I believe they provide, from what I remember, they provide the medication.
The patches.
The patch.
So that's
So-
for anyone out there who's trying to quit smoking. I know it's very difficult. 211, and they'll kind of talk you off the ledge.
Right, and
Right?
they can give you the cessation programs around in your area.
Okay. And then for the alcohol abuse, what do you work with? Different sorts of groups like AA, or how is that done?
We don't work directly with AA. Again, that would be something that we would kind of refer people to. Again, 211. 211 is a wealth of.
Oh, so 211 is not just for nicotine and alcohol.
Oh, no.
cigarettes. Okay,
It's
it's for any sort of
service.
Right, any sort of
okay.
Service. Like if you want to find out about a good daycare for your child, you can call 211.
Right.
Yeah, I had no idea there was
Yes.
a 211.
Yes.
So you call up and say, here's what I need, and they'll
Right,
just
and
connect you.
Yeah,
Oh, that's awesome. And that's a public health agency?
I mean, it's through the United Way.
Oh, okay.
Yes.
But that would be, so 211 is like a public health initiative.
It's been around
That's
for a while now.
fantastic.
Yeah.
Yeah.
Very helpful.
Very helpful.
Very easy to access. There's people there that are always ready and willing to assist you in any way they can, and it's a great service. It really is a great
Wow,
service.
That's news to me. So now, tomorrow, you're talking about, or the topic for tomorrow in the National Public Health Week is?
Preventing communicable diseases.
Preventing communicable diseases. Now, any communicable disease? I mean, we've got this sexually communicable diseases, colds and flus. So it's pretty much the gamut of that.
Right. We really want to concentrate this year on letting people know. It sounds simple, but how to wash their hands properly.
Right.
And we'd love to tonight demonstrate this
Well, we
to
would-
the public and let them know how to do that
proper way
properly.
to. Well, I do think that people don't. I mean, it's very embarrassing. But you do observe people not washing their hands
Right.
Yes.
after going to the bathroom. And when my kids were young, and even today, when I'm outside, when I come into my home, one of the first things I do is wash my hands, because you're out. Think about it. You walk into your house and not that I'm a germaphobe, although some people think I am. I only play one on TV, but you're touching everything in your house, and you've got germs on your hands. So
Right.
it is, just something that simple as hand washing
Can prevent the flu
can prevent the
and colds.
flu.
Yes. There are actually specific, after specific activities, after all activities, but certain activities especially, like before you prepare or handle food, you should be washing your hands. After caring for someone who's sick, if you're caring for a young child and you have to change them, if you're touching garbage, or if you're touching an animal, even if you are touching your pet, you do really want to wash your hands, especially after you blow your nose, after you cough. Also, after you treat a cut or wound, touch money, especially when you go to the grocery store. Some of the dirtiest places are shopping carts, ATMs, gas pumps. So you really want to.
Gas pumps.
Yeah.
I wouldn't have even thought of that. Right?
Yeah.
So now, could you demonstrate the proper way to wash your hands here? Could we sort of, because I think, I think people have the general impression they can just sort of rinse the germs away a little,
Yeah, I mean, we
1 or
can
2
go over the
seconds
steps and
under the
what you-
faucet.
Yeah, I mean, first you want to wet your hands with clean running water, preferably lukewarm water, and apply soap. That's the first step. And then you want to rub your hands together to make a lather, scrub them really well. And make sure you get in between and your nails.
Underneath the
and-
fingernails.
Yeah, and
Gosh.
continue rubbing. And, it's kind of fitting because it's going to be Lori's birthday pretty soon. And this is a good thing to remember, is to sing. If you don't know how long to wash your hands, you sing happy birthday twice.
2 times.
Twice?
It should be
Yes.
approximately 30 seconds that you're lathering your hands
Okay.
with the soap.
So you don't have to sing it. I don't have a good voice, so I'm not going to sing happy birthday to Lori. But you can hum it to yourself, and that's
Well,
how
that
long
is a
you should
good
do
way
it.
to
remember.
rather than just counting.
Right.
Right.
So, and you can, make yourself happy,
Two. As the germs slide off your
Pass the
fingertips.
time, yep.
Yeah, and you want to rinse your hands well and then dry your hands either with a clean towel or let them air dry.
Okay. So, I'm sure there's people at home thinking, screw it, I'm not doing that. I mean, seriously, it takes a lot of time.
I mean, if you're desperate, I'm not promoting this, but if you don't have the time and there's no sink nearby, you can use that hand sanitizer. But that's the second resort. You should really wash your hands is the preferable way.
Yeah, and don't you think maybe this is something that the Central Connecticut Health District could maybe, when we were growing up, we had those handy wipes. Like
Sanitizing wipes.
Yeah, but it was really just like alcohol. It wasn't all those antibacterial. It was just, alcohol in a kind of an emollient that would literally wash away the germs. Don't you think that's a better idea than the hand sanitizer? Because you use that stuff, you get dirt on your hands, and then you put the gel on top. It's like, ugh. It's a horrible feeling. It doesn't feel good.
Yeah, I would say, both of those ideas, the hand sanitizer and that wipe would be secondary to the hand washing.
I'm not implying that we shouldn't
Yeah.
wash hands. Exactly.
But I do
So,
agree, it would be nice to wipe your hands with a cloth and then just be able
And
to
then
throw the cloth away.
Yeah.
So,
So Thursday's theme is?
Thursday's theme is reproductive and sexual health.
yeah, and what we're really doing with this theme is we want to make sure that people are aware of when they should be getting screenings for cancer, cancer screening.
Oh, okay.
And we refer to the American Cancer Society for this. The first cancer topic would be breast cancer, and you should be getting a yearly mammogram from the age 40 on, and a clinical breast exam every 3 years for women in their 20s and 30s. And women should be doing self-breast exams and really get to know their breasts and then report anything if they find something to their doctor. And then the next is colorectal cancer. And beginning at age 50, both men and women should get a colonoscopy. Very important. And if you do not know your family history, then 40.
Oh.
You should be getting a colonoscopy at 40 if you do not know any family history.
Now, do you have any initiatives with communicable sexual health, or is this mostly prevention of cancers and things like that, this particular day?
The services we've offered in the past have been more preventative
Yes.
for cancer. We did have a grant from the Susan G. Komen Foundation where we were providing free mammograms for women. It was a $50,000 grant. It was only a year-long grant, so unfortunately it is over. But it was really wonderful to be able to provide services to women who really needed it in our 4 towns.
Who didn't have insurance and who didn't have access to get
what
mammograms.
is the cost of a mammogram for someone who would not have coverage?
It's about $150.
And for the colonoscopy, it's very expensive.
Yes, I'm not sure of the cost of that, but
Yeah, I
yes,
think
it
it's
is.
in the thousands of dollars, which definitely would be a hardship. You can see where people that don't have coverage
Yes.
are there not getting their colonoscopies.
Right. They just can't afford it.
Yeah.
They can't afford it,
Right.
and what are they going to do if they have cancer anyway? They don't have insurance. I mean,
Right.
that's like a whole nother. That's a whole nother topic. But it is, I think, something that it's good that at least certain services are.
Yeah.
There's some help for people. So the final theme for the week is mental and emotional well-being.
Well, mental and emotional well-being is something that's very much tackled in the town of Wethersfield specifically. We do have a wonderful social and youth services department. They're located on the ground floor of the town hall, actually right down the hallway from the Central Connecticut Health District. And they provide youth and family counseling on a sliding scale basis. They don't provide counseling services to individual adults unless it's a parenting or family related.
Okay.
There are some things that they do refer to specialists, such as eating disorders.
So if I'm hearing you correctly, there's actually free counseling, emotional
If they
mental health counseling.
if they apply, I believe they have to apply and be eligible for it. But yes.
But there are certain issues that they are likely to refer on, such as eating disorders, serious drug abuse, and things like that.
So life-threatening issues.
Yes, yes. But they do accept referrals from parents, from DCF workers, from police officers.
The school.
Schools, yes, guidance counselors. And they do also provide resources to families to help them figure out where they can get the services they need. So if they do have somebody who is battling an eating disorder, they will assist them with the further steps that they need to take. And also they do actually have a food bank. It's very much run on volunteers. It's a pretty well-staffed food bank. They do offer energy assistance and information how to access other programs within the town.
And that's all under the mental and emotional well-being.
Yes, this is the social and youth services. If anybody has any question or information or wants information for counseling services, they can contact Pat Meskel at 860-721-2977.
Maybe you could repeat that, Lori, again about the name and number.
Okay. For information on counseling services in the town of Wethersfield, you can contact Pat Meskel at 721-2977.
Okay. So how can the communities get involved in National Public Health Week?
Well, we do have proclamations that were signed by all 4 mayors in all of our 4 towns, Berlin, Newington, Rocky Hill, and Wethersfield. They will be placed in our libraries on display, and it's just a proclamation that all of the mayors are proclaiming the week National Public Health Week, and it just describes a little bit what National Public Health Week is. Also, there are books on the different topics that were taken out from the libraries, and those books are on display as well with the proclamations. So if you go to your local library, if you go to the Wethersfield Library, they are there and they are available.
Okay. So that's National Public Health Week, right?
Yeah, and I just want to say the overall things that we're really trying to get across to the public is stay away from tobacco, stay at a healthy weight, get moving, exercise,
Your way.
eat healthy with plenty of fruits and vegetables, and limit alcohol intake. And also protect your skin. That's a big one. A lot of people forget to wear sunscreen out there. And know yourself, your family history, and your risks. And have regular checkups at the doctor. And know your numbers, your cholesterol and blood pressure.
Yeah, I think that is people don't know their number. So really, you guys are kind of like really kind of just the people that, I don't want to say the friendly little naggers, but you kind of are just trying to help people do the things that we all know we need to do, and we're all too busy, or Or maybe we just need help getting started, especially with some of these eating and exercise initiatives.
And if anyone has any questions they would like to ask or want to be involved with any of our programs or sign up for the nutrition or the gardening classes, they can call us at 860-721-2822.
Yeah, because your group, the Central Connecticut Health District, it's not just about this Public Health Week.
No.
No.
Right? So maybe you could talk about a little bit the other things that you do
Okay.
besides this week. I know in next month you're having an asthma awareness.
Yes, we're having hosting our 3rd annual World Asthma Day, but this one's going to be a little different. We are actually having a legislative breakfast, and we are asking legislators to please be aware that asthma is a really serious problem, and to advocate and make legislation come about for reimbursement for asthma education. Right now, if you go to the doctor and the doctor often doesn't have time or he does not give the asthma education needed, it's because they're not getting reimbursed for it.
Yeah.
And it's very important.
And what do they have, Hillary? I think they have 7 minutes.
Yes.
So you figure you have a child, or maybe you yourself have developed asthma, and you're scared, and then now you're going to take all this medication and these
Yes.
inhalers. You don't know how to do it, and your doctor has 7 minutes to tell you how to take care of yourself.
Right.
And you have a life-threatening disease, because
Right.
people die from
Chronic
asthma, don't they,
disease,
Lori?
yes.
And Hillary.
Yes.
And
Yeah.
it never goes away
do.
either. People think that asthma, they'll get rid of it. It's you'll always have asthma.
Right.
So that's why you have to
So
learn to
once you
control and
develop
manage it.
asthma, you know, likelihood that you're going to, you know, stay having that disease, and
Right.
and besides just the logistics of using the medications, the doctor has no time to sit with the patient and talk about lifestyle, diet. There's a
Right.
myriad of things. Maybe you could talk a little bit about some of
That's
the things
what-
people can do.
Yeah, that's how we get to these people, is through our Putting on Airs program. It's a home visitation program, and we have a sanitarian and a nurse that go into people's homes and look for triggers in the home that can exacerbate asthma, such as pets, dust mites, mold in the home, water damage that can cause problems if they're not cleaning enough in the house. And we make recommendations. And we also go over, the nurse goes over the medications with them. They bring out their medications, and he or she makes sure that they're following and taking their medication as they should.
So that's really something that the doctor doesn't do or can't do. So
They do it, but not to the extent. We take the time and go into the home and take as long as it takes to really explain to these folks.
So what type of initiatives would you like to see? What ideally do you think should be happening between the patient and the doctor?
They should be, in my opinion, and with the what the Connecticut Asthma Advisory Council is saying, is that they should be reimbursed for education and take time to explain to the patient and give them an asthma action plan. And that's another part of the legislation, is we really would like to see asthma action plans become mandatory.
Now, what is an asthma action
An
plan?
asthma action plan tells the patient how to take their medication, and it also gives a sick plan if they get sick, what they're supposed to do, just step by step.
Oh, okay.
Take this amount of medicine, and it's clearly written out.
yeah.
And it also should be given to the school nurse.
Okay.
Because a lot of symptoms happen at school, and they might have to take medication during school. But this is not a mandatory thing. And so a lot of the nurses at the schools don't receive asthma action plans, and people don't utilize them, the doctors, some of them.
And when you think
it's a
of
problem.
it, right? And when you think about asthma, I mean, this is asthma. People literally stop breathing, right? And I don't know. I mean, I've witnessed several asthma attacks. I'm not myself, but with people that I know, and it's horrifying.
Yes.
And to think that, you know, people are not fully educated about how to administer their medication that's
Right.
going to
What to
save their
do.
life. You know, this
Yeah.
isn't just like taking some kind of a maintenance
No, this is
drug. This is a real serious situation that sometimes people wind up in hospitals.
Well, that's the
and you would think that if some of these things were
Yeah.
initiated, you
and so we really urge
could prevent a lot of
people-
those hospitalizations even.
Right, we're really urging people to call their legislator and tell them about this World Asthma Day and have them attend the legislative breakfast. It starts at 8:30 on May 1st at the Legislative Office Building, and we're providing breakfast, and we're giving out a legislative packet which details what they need to support and how important asthma is.
Now, have you have a bill written, or has
Not
this
yet, no,
Okay.
but we are,
So
we
you're-
want to do this,
so
and we
you-
need the support of the legislators to make this happen.
Do you need to have a legislator draft the legislation for you, or is this
No,
something that
but
you
we
can
need them to-
propose and then they'll?
We can propose
up.
it, and it has to go through several committees, such as the Public Health Committee, the Education Committee at the Capitol.
Now, which of our state Congress people are on the health committee? Do you know?
Yeah, that I don't know.
Okay. Because I'm wondering if
we
it's,
can find
if
out.
it's, yeah, because if it's anyone from
Yeah.
the region within our viewing audience, I mean, that definitely would be worth a phone
Yeah,
call.
we definitely want them to, and we're having Jewel Mullen, which is the Commissioner of the Department of Public Health, will be there speaking about this, the importance of asthma,
World Asthma.
World Asthma
Where's
Day, and
Day?
asthma management.
And how many, do you know how many people in Connecticut, the percentages of people in Connecticut that are afflicted?
Not off, I mean, I have statistics about it, but not off the top of my head.
Because it seems
but-
like Connecticut in particular is very hard hit with asthma.
Well,
Could you explain that?
the Northeast in general has the highest rates of asthma.
And why is that?
They
Hillary?
believe, they're not totally sure, but they believe it's because of the way the winds come down from Canada and bring the air quality down in the Northeast.
So
and
we
the-
have poor air quality.
and
Plus
the-
we have a lot of
and the changing
vegetation,
seasons, yes,
a lot of
the trees
changes. Just
and
the
the
seasonal
foliage.
allergies, I think, after
Yes,
time.
and that
could maybe-
definitely contributes to it.
Yeah.
Absolutely.
So it's a real respiratory challenged
Right.
state. But you know, just the whole long-term effects. You can imagine a child with asthma trying to sit in a classroom and pay attention. You know, it's
Yeah, we did in the past, and it's still a great program, and there are still some people that do it. It's called Open Airways at school.
and what
it-
is open airways?
It's a program from the Lung Association, and you go in and someone teaches the kids at school how to manage their asthma. It's during school time.
Oh,
And that's still going on in Hartford, I believe. But it has dwindled, but I think it's a great program. And
why has it dwindled?
because it's very difficult for schools to take the time out of their day to do this,
Oh.
because they have set curriculums, set times for kids to be doing certain things, and they find it difficult to incorporate this. But I think it's really important, and it needs to be incorporated. And it's hard to do it after school because of transportation issues with the kids.
Well, right, everyone's running. Right.
So it's best to do
So
it during
truly,
school.
if doctors had the time when their patients come in to take care of what needs to be taken care of, all these other things would not be so,
Yeah.
important to be making sure they're happening. Well, Hillary and Lori, thank you so much for coming on.
Thank you very much.
Thank you for having us.
In the Central Connecticut Health District, you guys do great work, and I think, hopefully we can provide you all with more visibility and
Yes.
exposure
Great.
in the future on our show. So to remember that we're right in the middle of National Public Health Week, and tomorrow is going to be...
Tomorrow is going to be preventing communicable diseases, so make sure
So
you wash
everyone
your
wash
hands.
their
Everybody to wash
Wash your
their hands.
hands.
Mindful hand washing tomorrow. And next month, May 1st
It's World Asthma
World
Day.
Asthma Day.
So anyone's invited. Anyone can come to the Capitol. The general public is welcome.
Come
we
to
also
the
have
Capitol.
come to the
There'll be
Capitol.
free breakfast. Come to the
Well,
Capitol.
that's only for legislators,
Oh, well,
actually.
okay. But,
they can come to afterwards from 10 to 2. We're having resource tables
That
all
would be
throughout the
great.
concourse, so people can know what's out there for asthma programming and management.
that's very important. And not only that, I think if the legislators see the public coming to the event,
Yes.
they're going to realize that this is something that maybe so. I think it's great that you guys are taking the lead on some of this legislative activity for the
Yes.
people of Connecticut. It was really my pleasure to talk to you guys tonight.
Thank you so much.
Thank you very much.
Thank you very much.
Thank you. Good night.
Night.